Good evening, everyone, and welcome to today's session. Good to see Maggie and many more. Maggie, thank you for your kind words in the comments about our daily live online sessions. So let us take up few more topics in anatomy. And today's session is going to be a little short, but 30-40 questions. Let us have a discussion on 5 to 6 important topics so that we get some kind of a extra oxygen to master the topic of anatomy. So, doctor, let us start with our next favorite topic of the examiner in anatomy will be the type of joint. If you take almost the past 30 years of almost 25 years of All India NEET PG AIMS PGI question bank, out of the 20 questions asked in anatomy, invariably a question was asked on the types of the joints, which you have to be very good. Good to see Dr. Narsi Bajia, bahut din ke baad. So, sphenoid omer joint is which type of joint? So, to make the best use of this session, doctor, keep punching your answers parallelly so that it will be more interesting. Please punch into the YouTube chat window, right? So, sphenoid omer joint is a shindialysis is what you need to remember. So, if you look at the sphenoid and the omer, classically, the rostrum of the sphenoid typically is here, which is being received by the ala of the omer, rostrum of the sphenoid fit with each other. So, shindialysis is a specialized suture, and a rigid bone fits into the groove of a neighboring element. That's how, like the cleft between the ala of the omer receiving the rostrum of the sphenoid is called shindialysis, is what you need to remember. Incudo-malleolar joint between incus and malleus. What is it an example of? It is called as a saddle joint. So there is a horse, there is a horseman sitting on the horse. So on what he is sitting is called saddle. So incus malleus के बीच में जो होता है, it is a saddle joint is what you need to remember. So what is the speciality of saddle? The concave surface of one bone will articulate with the convex surface of the another bone. Another example of a saddle joint is between the metacarpal and carpal. So metacarpal will become phalanges. So carpals, metacarpals, then phalanges. So between carpal and metacarpal, carpo-metacarpal joint. Good to see Suhani, Patak, Narsi, Bajia, Maggie, and many more. So is an example of saddle joint. So first carpo-metacarpal joint, please don't forget this list, doctor. Sternoclavicular joint, calcaneo-cuboid joint, incudo-malleolar joint. They are the examples of saddle joints is what you need to emphatically remember. So you have a plane joint, saddle joint, hinge joint, pivot joint, ball and socket, and ellipsoid. That's how you have different types of joints in various areas. So this is one favorite MCQ repeatedly asked in the NEET PG entrance exam. Now, a plane joint is also called gliding joint. Here, one moves across the surface of another. Acromioclavicular joint is a clavicle has got a sternal end, and along the scapular side it has got a acromioclavicular joint. That is a classical example of the plane joint is what you need to remember. हिंज जॉइंट, हिंज होता है आपका रूम का डोर होता ना, जैसे आप उसको ओपन क्लोज करते हैं. So there is a movement around one axis that passes transversely through the joint. So suppose you are doing a movement, axis is transverse to the joint. So humero-ulnar joint is an example. It will permit flexion and extension. That is the hinge joint is what you need to remember. Then comes the pivot joint. It will allow the movement around one axis that passes longitudinally, not transversely. So atlantoaxial joint is a pivot joint. Bicondylar joint, classically knee joint is an example. Condylar joint, इसी का नाम है ellipsoid joint. Condylar joint को भी ellipsoid joint बोलते हैं. It will allow the movement around two axes that are right angle to one another, so that it will permit flexion, extension, abduction, adduction, a limited circumduction. So wrist joint जो होता है condylar joint, otherwise called ellipsoid joint. So saddle is something, it will allow movement around two axes which are at right angle to each other. It will permit flexion, extension, abduction, adduction, circumduction. Carpo-metacarpal joint of the thumb and sternoclavicular joint are the examples of saddle joint is what you need to appreciate. Similarly, there is a ball and socket joint which will allow the movement around multiple axes basically. It will permit extension, flexion, abduction, adduction, circumduction. Only gliding is not permitted. Hip joint, glenohumeral joint, they're all ball and socket. So each of these types of joints, doctor, any entrance you go, it is the most important topic. Now, these are all the examples of fibrous joints. So where do you see fibrous joint? The skull sutures, syndesmosis, gomphosis, they're all fibrous, not symphysis pubis. So according to the structure of the joint, you call cartilaginous, fibrous, synovial. Cartilaginous, fibrous, and synovial. So what are the examples of cartilaginous joints? They are connected entirely by the cartilage. So they can be synchondrosis or they can be symphysis. So mainly, why do you require cartilage? Cartilage is like a cushion. Good to see Sanket, Tamboli, Muhammad, Umar, and many of our friends. Please drop a line in your social groups that the Chai Pe Charcha with Dr. Murali Bharadwaz has already started. So synchondrosis, symphysis. Whenever you require a lot of movement between two joints, you require a cushion of cartilage. That's how cartilaginous joints are there. Synchondrosis ko hi bolte hain synarthrosis. They are primarily cartilaginous joints. whenever there are two ossification centers separated by a cartilage, इसको कहते हैं synchondrosis. So the best example is a growth plate between the head and shaft of developing long bone. It will allow the bone growth and eventually become completely ossified. That is called synchondrosis. Symphysis. It is a secondary cartilages where two separate bones are interconnected by a cartilage, mostly occur in the midline. So pubic symphysis, intervertebral disc, they're all the examples of symphysis, which is also called amphiarthrosis, is what you need to remember. Finally, you have fibrous joints where the bones are connected by a dense connective tissue, which is generally collagen. So sutures, syndesmosis, gomphosis, they're all the fibrous joints. So that is what you need to remember. And some of these इन चीजों में कुछ चीजें बट्टी मारने वाला चीज है, जरा आप दिल लगा के उसको you have to memorize the type of joints. Very good. Question number 107. Nursi Bajia is betting on condylar joint. Absolutely. Wonderful. So, doctor, the condyloid joint is between radius, scaphoid, and the lunate. इन चीजों के बीच में जो है वो condyloid joint, which will permit multi-axial movement, is what you need to remember. Superior radio-ulnar joint. You can see here the example. Superior radio-ulnar joint is basically a pivot. So, superior radio-ulnar joint is a example of a pivot joint, is what you need to remember. So that is a quick story, doctor, and a little bit of theory when it comes to the topic called, this is topic number 15, called joint types. So the main intention of this crash course, containing 200 hours of video lecture where we revise all these 19 subjects for the PG medical entrances. With 10 to 15 questions, I want to introduce each of these high-yield topics, जिसको आप ध्यान से रिविजन करना है, these important topics को, बराबर? Now, the next topic number 16 is liver. So totally there are 56 topics I am going to discuss, around 300 to 350 questions in anatomy, but out of them, the 20 questions the examiner is going to ask is going to come from these 56 topics in anatomy, which you have to be very sure. Right, doctor? So, every day, दोपहर टाइम मिले तो दोपहर, नहीं तो शाम, कभी कभी बहुत दोपहर है और शाम आपके साथ हम स्पेंड करेंगे और पूरा रिवीजन मारेंगे. Right? So, please don't forget to be part of our WhatsApp study group, so that before we start the session, we will send you a small alert. And please don't forget to download the Incus quiz app. All these topic-wise questions are being positioned as quiz tournaments in the Incus quiz app. Once more, I like to bring to your attention, you go to Google Play Store, you have Incus Quiz Play, hourly multiplayer live quiz app. So please write some good comments after you like the app. You can play Khelte 20,000 questions. 20,000 questions you can play as 1,000 quiz tournaments arranged topic wise. At the end of it, we will give you analytics. What are the questions that are going right, wrong? What topics are going right, wrong? You can bookmark the questions. And there are also audio, video comments added by some of the best national faculty will be shortly adding audio, video comment. You too can add audio, video comment to every question. There's an explanation available. So that way, learning become a game. Anywhere you can sit, just start, play, you can know the same quiz tournament played already by, let us say, 100 people. How your peers are answering, how you are answering, you will be able to get that real edge of the seat excitement of adrenaline. So please make it a point to play the quiz tournaments on the Incus quiz app. So doctor, the next topic is liver. So some of you are going to be top hepatobiliary surgeons. You go to AIMS, PGI, any exam in the world. Covenant's classification is one of the most high yield topic for the examiner. So hepatic artery, portal vein, bile duct. They are the basis of the division of the anatomical segments of the liver is what you need to remember. So not the hepatic vein. So totally kitna segments, Covenant segments are available. So you should remember there are totally 8 liver segments. Segment 4 sometimes is being divided into 4A and 4B. The numbering of the segments runs in a clockwise manner. Segment 1 पीछे रहता है. अगर आप आगे से देख रहे हैं तो लिवर के पीछे क्या होता है? Caudate lobe. So caudate lobe is called segment 1 and it is not visible in the frontal view. So the caudate lobe of the liver lies in segment 1. So आपको ये नीचे ये 1 जो है ना वो फ्रंट से दिखता नहीं. So 2, 3, 4, 5, 6, 7, 8. So you are going in clockwise manner is what you need to remember. Now, ligamentum teres develops from where? This is a बहुत मसाला question. Embryology, garma-garam padna padega. Question number 111. Can you be able to punch the correct answer, doctor? All the students who are attending. Ligamentum teres. Can you be able to punch your answer? Ligamentum teres. Let me see how you will answer. Yes. Question number 111. Very good. Vaibhav, Mittal, Maggie are betting on C versus A. Okay. Oh no, doctor. Akram also is clean bowled. Ligamentum teres, umbilical vein. So, doctor, this is right lobe, this is left lobe, this is coronary ligament, and this is the round ligament, which is called ligamentum teres. This is called that. बराबर? So ये falciform ligament होता है, and this is the round ligament, which is called ligamentum teres. So the round ligament of the liver, which is also called ligamentum teres, it is the degenerative string tissue that is continuing as the free edge of the falciparum ligament, falciform ligament. So it is the fetal left umbilical vein, doctor. Fetal left umbilical vein. When you become adult, it becomes the round ligament of the liver. That's the point you need to appreciate. Yeah. Okay.
Hey, tomorrow is my birthday.
Oh, good.
Students, tomorrow is my birthday.
Okay.
It's November 5th. Bye. Good night.
Yeah. Good.
Okay,
I'm just joining the birthday celebration. No worries.
I'm closing the door, okay?
Yeah. Okay. So a lot of kids are waiting. Today, my second kid, Abhinav Bharadwaz birthday is there. So 12th birthday. So they're all waiting for. Yeah. They're all waiting for a small cake cutting below. So I thought, let me finish the class and join. Yeah. So left umbilical vein is round ligament of liver. So doctor, remember that this is one important point in exam tomorrow. If you look, the right hepatocardiac channel from the liver to the heart, it becomes hepatic portion of IVC. So, thank you. He require all your blessing, doctor. So, my elder son is 23. Most of you belong to his age, Manu Bharadwaj. And my younger kid is Abhinav Bharadwaj, who is about 12, almost 11 years younger than my elder guy. So, yeah. So, I always advise the medical students getting top rank in NEET PG, settling in profession, वो सब होता है ऑटोमेटिकली. हर एक को एक अच्छा ब्रांच मिलेगा जरा मेहनत करे तो. But don't postpone simple pleasures of life like falling in love with a girl or a boy, or getting married, or going for a romantic dinner, or spending time with your parents, because they will not be throughout our life, throughout the journey of our life, very short duration. So, or don't forget to spend with your grandpa or grandma, because they have too short a time to spend with you, or partying around with your friends. All such simple pleasures of life, doctor, we should always not miss just because there is some stupid entrance or some target to achieve. No, because life is more precious. So that's the reason I always advise some students say, sir, seat aane ke baad shaadi karna hai. Not required. Marry, enjoy a good life, produce kids, everything parallelly, also academically achieve. Don't delay things because of some NEET PG entrance, blah, 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 or anything, you know. In fact, when you get married to someone, you have someone to share with all your agonies, all your anxieties, all your uncertainties, all your unhappiness, and also happiness. That gives you a fully circular, rounded component in your life. And a person who is happy in mind can better perform in a exam whenever they face. So that's the reason, don't worry, right? So Maggie is saying, in spite of important day, thank you for taking time for us, sir. Honestly speaking, the most important day and moment will be to spend at least half an hour with all you guys, because shortly some of you are going to become toppers, very busy in your life as a residents. That day you may not be there, but I will always remember this most relishable moments that I spend with you every day, at least in this YouTube, sitting in the home, right? So now, the right umbilical vein regresses The proximal left umbilical vein also regress. Distal left umbilical will persist as the round ligament of the liver is what you need to remember. Some of you have answered ductus venosus, but ductus venosus typically become ligamentum venosum is what you need to remember. Now, Kupffer cells, where do you find? We find it in liver. So that is quickly a short review on the topic called liver. Topic number 17 in our list is orbit. A lot of times questions come on the orbit. The orbital septum, how is it formed? It is the palpebral ligament which forms the orbital septum. So if you look at the structure, there is a lateral palpebral ligament, medial palpebral ligament, there is a lacrimal sac, there is a superior tarsus, there is an inferior tarsus. So and this is the aponeurosis of the levator palpebrae superioris. All the muscles of the face, motor supply is by the facial nerve. All the muscles of the face, motor supply is by facial nerve. The only muscle of the face whose motor supply is not facial nerve but oculomotor nerve is levator palpebrae superioris. That's the reason oculomotor nerve palsy typically lead to ptosis as a presenting feature. So the orbital septum, which is called palpebral ligament, extends from the orbital rim to the eyelid, and it forms the fibrous portion of the eyelid. So who contributes maximum to the floor of the orbit? It is the maxillary bone. So there is a orbital portion of the maxilla. So this orbital portion is very thin. So whenever it hits you in a boxing, there can be a blowout fracture, and the orbital process that will lead to the tissue in the orbit to droop down, and that is called teardrop sign is what you need to remember. So the orbital floor is formed by the orbital plate of maxilla, orbital process of the palatine bone, and the orbital surface of the zygomatic bone. So most of it is basically by the orbital surface of the maxilla. If you look at the various extraocular muscles, the muscle which is not attached to the apex of the orbit. Who want to take this bet? Question number 115. Can you please punch your answers? Yes. Muscle not attached to the apex of the orbit. Yes, doctor. I'm waiting for your answers. Kaun banega PG Pati? Shoot your answer. Narsi Bajia is betting on superior rectus. Arun Guru is betting on superior oblique. Superior oblique. So you should remember, doctor, it is the inferior oblique. Superior oblique, superior rectus, lateral rectus, medial rectus, inferior rectus, and they're all are attaching to the apex, annulus of Zinn, but not the inferior oblique. It is not going to attach with the apex, is what you need to remember. Now, which bone contributes to the medial wall, lateral wall, roof, and floor of the orbit? You need to be 100% sure one of the high topics of the exam. So, ethmoid, lacrimal, frontal, they are the contribute to the medial wall of the orbit. So, ethmoid, lacrimal, frontal, they contribute to the medial wall of the orbit. So, the roof is formed by the frontal and sphenoid bones. The roof is formed by frontal and sphenoid. Posterior aspect of the lateral wall is by the zygomatic and sphenoid. And the floor is formed by the maxilla, zygomatic and palatine. Medial wall is by the ethmoid, lacrimal and the frontal. So you have to be very sure on the different walls of the orbit. If you fully adduct the eye, then who is responsible for elevating it? Always the purpose of the obliques is that inferior oblique elevates, superior oblique depresses. Reverse to their names. Whereas superior rectus elevates and inferior rectus depresses. But if you look at the completely adducted position, elevation is mainly contributed by the inferior oblique. So you should know every muscle's primary, secondary function. This is one favorite question, extraocular muscles and functions. So ophthalmology में भी हम गर्मा गर्म discuss करेंगे इसको. Adduction by middle rectus, lateral rectus is abduction primarily. Superior rectus is elevation, which is maximal in the abduction, not in adduction. Whereas inferior oblique also lead to elevation, maximal in the adduction, not in abduction. Superior oblique is depression, maximal in adduction. Inferior rectus is depression, maximal in the abduction. That is what you need to remember. And typically all superiors are intorters. All superiors are intorters. All inferiors are extorters. If you look at inferior oblique, inferior rectus, they both lead to extortion, whereas superiors are intorsion. That's what you need to ultimately remember. So that is a quick story of our topic number 17, which is the orbit. अभी आ गया spermatogenesis. Secondary spermatocyte, primary spermatocyte. इसका स्टोरी क्या है? Secondary spermatocyte is haploid. So you should know the spermatogonium is 2n. On mitosis, it is still 2n. On meiosis 1, it forms secondary spermatocyte, which is haploid. That undergoes meiosis 2 to lead to spermatid formation, which is also haploid. That undergoes differentiation to form the sperm is what you need to remember. So which will not undergo any further division out of all this. By the time spermatid it reaches, typically it will not undergo further division. It will only undergo differentiation. एक बनेगा, दो बनेगा, चार मगर चार रहेगा, चार मगर spermatid, चार spermatid रहेगा, चार sperms. The only thing happening is a differentiation is what you need to remember. Now, during ejaculation, how the sperm finds its way. Typically, it is released from the epididymis. Epididymis is like that storehouse where maturation of the sperms occur. Sperm को swimming coaching classes को जाता है. Epididymis swimming teacher है. वहाँ उसको तैरना सीख लेता है. So epididymis. So the spermatic cord, the head of the epididymis, Then you can see the body of epididymis, the rete testis, the efferent ductules, the ductus, vas deferens, where you do the vasectomy, the tail of the epididymis. So this is the typical structure which you have to master. So whenever the sperms are making a journey, so what is their journey basically? They start in seminiferous tubules, go to straight tubule, then to rete testis, efferent tubule, epididymis, vas deferens, ejaculatory duct, and finally urethra is what you need to remember. So where is the mitochondrion of the sperm, which is responsible for all that energy it required for swimming? Kahan rehta hai? In the middle piece. So basically there is a head, there is a neck, there is a middle piece. That is the place where the mitochondria are located. What are the supporting cells of the testis called as? Subtly cells are all supporting cells. So you have the spermatozoa, spermatids. These are primary spermatocytes. These are the spermatogonia. And here you have the supporting cells, which are basically called the subtly cells, is what you need to remember. So that is a quick story about the spermatogenesis. If you want more practice topic-wise, you can always play 20,000 quiz tournaments on the Incus quiz app. You can also go back to onlinemmbbs.com video library, where you have extensive revision from PGI, AIMS, everywhere. You go to the topic spermatogenesis, you will find, and there you can further have practice of the questions. But at least you should know 56 topics. On each topic, at least 10-15 points before you can confidently face the examiner. So that is the purpose of this 200 hours of session. Now comes the triangles and quadrangles, is the next favorite topic. Between the medial border and of the scalenus anterior and the longus colli, what do you have? So we have sympathetic trunk, thoracic duct, inferior cervical ganglion, they're all the part of it. So this is the rectus capitis lateralis, rectus capitis anterior. This is the middle scalene, posterior scalene, longus colli muscle. This is the anterior scalene, this is the posterior scalene, and this is the middle scalene, and this is the longus capitis. So you should know all this. Neck mein kya muscles hai, neck mein kya triangles hai, everything. So all these prevertebral muscles, they include longus colli, longus capitis, rectus capitis anterior, rectus capitis lateralis. So between the scalenus anterior and the longus colli, between the two, you have the common carotid artery, is what you need to remember. So if you look at the scaleniovertebral triangle, scaleniovertebral, so here you have the prevertebral muscles and vertebrae. So scaleniovertebral triangle. So longus colli, scalenus anterior, transverse process of the 6th cervical vertebra, that forms a triangle, and it contains first part of subclavian, sympathetic chain, the vertebral artery, thoracic duct on the left side. So these are the contents of the scaleniovertebral triangle is what you need to remember. So one or the other triangle or quadrangle, what are its boundaries and what are its contents is the favorite question of the examiner. Kellogg's triangle, what do you see? Cystic artery, right hepatic artery, lymph node of Lund. These are the components of the Kellogg's triangle. So भैया ये होता है लिवर में gall bladder, cystic duct, common hepatic duct. So here you have the liver, and this part we are talking, which is called Kellogg's triangle. So hepatobiliary triangle, cystohepatic triangle, it is also called Kellogg's triangle. So it is the inferior surface of the liver. Common hepatic duct is there medially. Cystic duct is there inferiorly. And that is how Kellogg's triangle is basically formed. So this is the cystic duct and the inferior surface of the liver. So now, doctor, cystic artery, right hepatic artery, lymph node of Lund. These are the components of the Kellogg's triangle is what you need to remember. Now, what are the contents of the adductor canal? So, femoral artery, nerve 2, vastus medialis, saphenous nerve, they're all the contents of the adductor canal. Not the popliteal artery, obviously. So here you have the femoral artery, saphenous nerve, the adductor canal, and this is that ribbon muscle called as sartorius. This is the vastus medialis. First year anatomy का formalin smell, nostalgic memory आ रहे हैं या नहीं आ रहे? So a adductor canal जो होता है इसी का दूसरी नाम होता है subsartorial or Hunter's canal. It extends from the apex of the femoral triangle to the opening of the adductor magnus. You have this adductor canal. So anterior and laterally is the vastus medialis. The vastus medialis is anterior and lateral. Posteriorly adductor longus and magnus. And the roof and the medial aspect is covered by the sartorius. So this is what makes the adductor canal. So the femoral artery, femoral nerve, femoral vein, the branches of the femoral nerve, that is saphenous nerve, nerve to the vastus medialis, they are considered to be the contents. It has got one superior, anterior, inferior foramina. Femoral artery, femoral vein, saphenous nerve go through the canal through the superior foramen is what you need to remember. So, cubital fossa, once more, triangles, quadrangles, these are all classical questions. It is the brachioradialis, which is the lateral boundary of cubital fossa. So, cubital fossa क्या होता है? Pronator teres होता है. Pronator teres is medial. Brachioradialis is lateral and the line joining the two. Most medial will be nerve, middle में artery, most lateral will be the tendon of the biceps tendon. So this is how the tendon of the biceps brachii is typically located most lateral. And the median nerve, the brachial artery. So the nerve is most medial, followed by brachial artery, followed by the tendon of the biceps brachii. So these are the important boundaries which you need to understand. So doctor, once more, triangles and quadrangles. One of them is going to come in your tomorrow's exam. So the last topic for the today's very short session Ureter is the favorite question of the examiner. Ureter in ureteric tunnel. Once more, I want to tell you, doctor. When you attend a session like this, sometimes जरा फटाफट हम खत्म करते हैं. Even before this, if you can kindly go back to the Incus quiz app, there if you can be able to go through the autoplay and live quiz tournaments in anatomy, you find all these topics, so you can finish the playing those tournaments. एक मर्तबा आपको कितने क्वेश्चंस राइट और रॉन्ग हो रहा है समझ में आएगा. So then if you attend this session, very interesting. Okay, so I advise all of you to download the Incus quiz app. The ureter in ureteric tunnel is very close relation with the uterine artery. So some of the gynecologists, in the process of ligating the uterine artery, they end up in injuring the ureter. So भैया a broad ligament होता है. This is the lateral cervical ligament, otherwise called cardinal ligament. You have a uterosacral ligament which is giving posterior reinforcement to the uterus, and here the uterine artery, and here you have the ureter. They both are very close. इसको ligate करने के प्रयत्न में यूरेटर को भी इंजरी कभी कभी पहुंचता है. So the cardinal ligament or McEnroe's ligament or a lateral cervical ligament or a transverse cervical ligament, बात एक ही होता है. It contains the uterine artery and uterine vein. So during the hysterectomy, there is a close proximity to the ureter, and that can get damaged while you are doing the ligation of the ligament. So that you need to be very careful. The normal constrictions of the ureter, what are they? When it is crossing at the pelvic brim, when it is entering bladder, when there is a pelviureteric junction, they're all the normal constrictions is what you should remember. So at the origin, at the pelvic brim, at the vesico-ureteric junction, normal constrictions. Now, doctor, this is another batti marne wala matter hai. Left ureter, right ureter, left kidney, right kidney. What are the anterior, posterior, medial, lateral anatomical relations? There is no other way. Anatomy is a subject of batti marne wala subject hai. कुछ भी नहीं कर सकते. मगर good thing is in spite of unlimited competition, the subject that you need to master is very limited. That is the good news I want to give you. Now, what are the relations of left ureter? Are all except external iliac. You have quadratus lumborum, psoas major, left gonadal vessels. भैया अभी आ गया, बेशरम इसको बट्टी मारना पड़ेगा. Right ureter, what are anterior relation? So obviously kidney is there, ureter is coming out on the right side. Here you have the liver. So the duodenum, terminal part of ileum, right colic, ileocolic vessels, right testicular and ovarian vessels, and the root of the mesentery of the small intestine, they're all anterior. बराबर? थोड़ा पेनफुल होता है सब चीजें याद रखने का. फिर भी you should dream that unless I master these things, how can I become MS General Surgery? I can only become if I crack the top rank in NEET PG. एक बार ऐसा सोचो, इसको याद रखेगा. And this is one thing definitely आने वाला चीज बोल रहा हूं ना, मैं गारंटी देके बोल रहा हूं. इसलिए बट्टी मारे तो भी your time is not a waste. Definitely आएगा कल के एग्जाम में. The right psoas separates the kidney from the lumbar transverse process and the bifurcation of the right common iliac artery. Now, what is the relation to left ureter? Left side में which part of gut रहता? Anus, rectum, sigmoid colon. So sigmoid colon, sigmoid mesocolon, left colic vessels, and the left testicular and ovarian vessels. And posteriorly on the left side, you have left psoas and the bifurcation of the left common iliac artery. But on the left side, inferior mesenteric vein is along the medial side of the left ureter. अगर यूरेटर ऐसे जा रहे हैं, मिड लाइन ऐसा है, तो उसका मीडियल एस्पेक्ट में आपको लेफ्ट यूरेटर रहता है. So what is anterior, what is right, and what is anterior to the left ureter? Everything you should be sure about it. Now, what are the relationship of the kidney? So right kidney अगर देखा जाए तो right suprarenal, liver, descending part of duodenum, then right colic flexure and small intestine. They're all anterior to right kidney. अगर left देखा जाए तो left kidney, left suprarenal gland, the stomach, pancreas, then left colic flexure, spleen होता ना, spleen भी anterior है. Then descending colon, jejunum, they're all anterior. So right kidney goes suprarenal, liver, duodenum, right colic flexure and ileum. Left kidney goes suprarenal, stomach, spleen, splenic artery and pancreas. So what is posterior relation of kidney? Basically, the diaphragm separates the kidney from the pleural cavity and 11th and 12th ribs. Psoas major is medial, posteriorly. Quadratus lumborum and transverse abdominis is lateral. Subcostal, iliohypogastric, ilioinguinal, they descend obliquely behind the kidney. That is what you need to remember. Similarly, what are the anterior relationship of the ureter? Duodenum, terminal ileum, right gonadal vessel, right colic vessels, and ileocolic vessels. Left side में left gonadal vessels, left colic vessels, and sigmoid colon and mesocolon are anterior. Now, what is the surface anatomy of ureter and the kidney? One of the favorite questions of the examiner. The hilum of the kidney, agar dekha jaye to, some of you are going to become nephrologists. You are going to do renal biopsy day in and day out. So the hilum of each kidney is 3 finger breadth from the midline in the transpyloric plane, and T12 to spine of the L3 it extends. Kidney moves 1 inch on respiration. The right kidney, because of the liver above it, will be lower by 1 inch compared to that of the left. Whereas if you look at ureter, take a point 5 centimeter from the midline at the level of the L2 to a point at the anteriliac spine. That is how the ureter courses, is what you need to remember. Now, ectopic ureter in male, where does it open into? It opens into prostatic urethra, most commonly. Once more, surgery में गर्मा गर्म topics हैं. There are totally about 80 topics in surgery. At least 1000 MCQs we are going to discuss as a part of this 200 hours of crash course every year. This is the 2021 200 hours crash course edition covering all 19 subjects. Now, ectopic ureter in male. So, in the female, ectopic ureter can open to bladder neck, urethra, vagina, vestibule of vagina. In the male, it opens rarely into ductus deferens, prostatic utricle, or seminal vesicle. The narrowest part of the ureter क्या होता है? At the entry, where uretero-vesical junction is there, that is the narrowest part, is what you have to remember. So, doctor, that brings us to this wonderful episode 4 of our anatomy. So, totally, I'm going to discuss 12 hours anatomy. Already we finished 4 episodes of anatomy and 5 hours of discussion. So I hope, and almost 20 topics we touch based. So now you know what is important, what to focus, what to read, what is high yield, what is going to come in the exam. So please be in touch and call our helpline to be part of our WhatsApp group, and keep attending this free live online session. All 200 hours is free for live online. But from tomorrow, after the class is over, we are going to remove the video. And all this video is archived in the online mbbs.com video library. And I want all of you to subscribe. Make a small payment to do the revision of the video. Good night and enjoy a great time.